The first thing that jumped out at me when this ECG printed out was the pathological Q waves and ST elevation I could see in lead 3 and AVF, with lead 2's ST segment and Q waves looking suspect too. These are the inferior leads, which means these leads look at the bottom of the heart. This patient had chest pain that sounded cardiac, so once I'd seen this ST elevation, I instantly thought I'm looking at a STEMI, which is a fancy word for a heart attack. We'd call this an inferior STEMI because the ST elevation is in the inferior leads. This prompted me to check out the other leads, where I found ST depression in lead 1, an AVL of the lateral leads, and leads V1 to V3 of the septal/anterior leads. When there's ST elevation in one group of leads and ST depression in another, the depression is known as a reciprocal change. This is particularly important when there's reciprocal changes seen in V1 to V3, because this could suggest a posterior STEMI. Now the elephant in the room is taken care of, I want to make sure I know the underlying rhythm, because I've been caught out on the phone to PPCI in the past when they've asked me what the rhythm is and I didn't know the answer. So this rhythm looks like a sinus rhythm because it's regular. There's P waves before each QRS complex, and the P waves are facing up in leads 1 and 2 and down in leads AVR. On my PRF I'd write sinus rhythm with an inferior STEMI and potential posterior involvement.